Good morning, everybody, and welcome to the Window on Ottawa session on water quality. I hope that everybody got an opportunity to enjoy Kerry Black in the keynote session this morning on reconciling a path towards water quality in Canada. So welcome to our session today on drinking water quality. This is one of my favorite sessions when we have the normal Window on Ottawa in-person conferences. But I'm certainly enjoying so far the virtual conference that we've had so far. So a nods to the organizers of the session, Water Canada and CWWA, for putting on this joint conference. So first I'll introduce myself. My name is Steve Craik. I'm the Director of Quality Assurance and Environment with EPCOR Water Canada. And what that means, I oversee our analytical operations, our testing laboratories, our process development team, and our environmental and scientific services within EPCOR in Edmonton and across our facilities in Canada. We've got two speakers here today that I'm going to introduce in a moment, both from Health Canada. Anne Vezina, she's the coordinator of the Federal Provincial Territorial Committee on Drinking Water. She holds a Master of Science in Environmental Health from the University of Montreal with a specialization in human health risk assessment, as well as a Master of Science in Environmental Toxicology and a Bachelor of Science in Biology, both from University of Quebec and Montreal. She's been working as a senior science advisor in the Water and Air Quality Bureau of Health Canada since 2005. And his primary roles since 2000 have been to coordinate the activities of the Federal Provincial Territorial Committee on Drinking Water and to contribute to the human health risk assessments for chemical parameters in drinking water, to support the development of the guidelines for the Canadian drinking water quality. And she's going to give an update on the Canadian drinking water quality guidelines today. After that, Stephanie McFayen is going to be speaking, and she's also with Health Canada, manager of the Water Quality Division. She's a scientist at Health Canada. She's the research manager of the Water Quality Program and has been working on water quality and human health issues for more than 20 years. Her focus is on understanding and dealing with the health risks from substances, including bacteria, virus, parasites, chemicals, and radionuclides in drinking water and in recreational water. She works closely with experts to develop guidelines and advice that are used as the basis for all the water quality standards to protect health of Canadians. Stephanie holds a BSc from Trent University, Ontario, and an MSc from Carleton University, Ontario, Canada. And she's going to be talking about a topic which is very near and dear to all water providers, PFAS compounds, perfluoroalkylated substances. Before we get into the talk, I'd like to provide a land acknowledgement. So although this is a virtual event, we wish to acknowledge that the land on which the Water Canada and the Canadian Water and Wastewater Association operate, it is based in, CWA is based in Ottawa, which has been the traditional land of the Algonquin and Anishinaabe Nation that has lived on this territory for millennia. Water Canada's parent company, Actual Media, is based in Toronto, and for thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and most recently, the Mississaugas of the Credit River. And today, while we are virtually meeting virtually, Toronto is still home to many Indigenous people from across Turtle Island. I'm from Edmonton, and in Edmonton, we are on Indigenous land in Treaty 6 territory. And this land has been occupied, traveled, and cared for by the Indigenous people since time immemorial. It's a traditional meeting place, a meeting ground, gathering place, and traveling route for the Cree, Saulteaux, Blackfoot, Métis, Dana, and Dene, and Nakota Sioux. And so we were grateful to have the opportunity to work on all of these lands. Okay, at the end of our, what we'll do for questions, after each talk, we'll have a short break for questions. Please put your questions into the chat, and then I'll be monitoring the chat, and we'll ask the questions. And if you like, you can ask your questions in French for this session today. So I'd like to start with our first speaker. Anne, are you ready to go?
Yes, I am.
I'll take it away.
So I'm going to share my screen. There you go. So good morning, everyone. My name is Vezina, as Stephen mentioned, and I work in the water quality program at Health Canada. And I'm here today to give you an update on what's up in the water program. So rapidly, what am I going to talk to you about? So I'm going to do a quick overview on our program, what we do, and our prioritization process, and discuss what our current and upcoming priorities are, as well as our public consultations, final documents, other web content, and the boil water advisory application on the CNPHI. So what's our water quality program doing? So in collaboration with our partner, we develop health-based water quality guidelines, and the main focus is drinking water. We also develop guidelines for recreational water as well as reclaimed water. And we are the technical secretariat of the Federal Provincial Territorial Committee on Drinking Water to develop health-based drinking water guidelines. So there's an ongoing need to update the existing guidelines as well as develop guidelines for new contaminants, and microbiological parameters undergo rolling revisions based on the rapidly evolving science in this area. Our program also develops drinking water screening values as well as outreach products as needed. And we work with the Public Health Agency of Canada and our PT partners on the drinking water application, which is the module within the Canadian Network for Public Health Intelligence, CNPHI, which is a real-time application in which drinking water data is collected on a national scale. So in a nutshell, what's our process for developing guidelines? It starts with the priority setting, which I will describe in the next 2 slides. Then we go into the risk assessment, where evaluators perform lit search and risk assessment, as well as treatment analytical considerations. Then once we have a draft document, it goes into internal and external peer reviews. And then we seek for endorsement from our PT partners as well as other government departments. Then we publish the draft guideline for a 2-month public consultation period. And then we seek, then it goes to review through our PT partners again and other department agencies before getting final approval from PTs as well as Health Canada, and we published a final guideline. That's in a nutshell, and from start to finish, the timeline will vary depending on the complexity of the file, but it goes between 2 years to complete from start to finish for 2 years for something very straightforward to 5 years, or sometimes maybe more for something that is a lot more complicated. So how do we prioritize the substances? So we go through a very thorough exercise every 4 to 5 years, which the last one was completed 2018 or 2019. So when we prioritize chemicals, we incorporate input from the health risk, treatment methods, availability, PT needs and exposure, as well as other government department needs. And then we base our priorities on 3 criteria to develop the guidelines. First one, the exposure to the contaminant could lead to adverse health effects. The second one is the contaminant is frequently detected or could be expected to be found in a large number of drinking water supplies throughout Canada. And the third one is the contaminant is detected or could be expected to be detected at a level that is of possible health significance. For the microparameter, as I mentioned, it's a rolling revision. Radiological parameters, it's ongoing monitoring of science to update as needed. And they are mainly based on the recommendations of the International Commission on Radiological Protection, ICRP. We also incorporate departmental priorities that could be added to the program's 5-year work plan. For example, in the last couple of years, we added pesticides to be able to be consistent with PMRA's recommendations. And as well, we could prioritize old guidelines that are published prior to 2000. Sometimes guidelines won't pop up as a high priority for a while, and then they get prioritized just based on their age, basically. For if anyone wants more information about the prioritization process, there's a link right here that you can access more information. So what are we currently working on? So this is a list of parameters that represent everything that we are currently working on. These are not necessarily guidelines. They could be screening values, or they could be problem formulations. And these are at different stages in the guideline development process that I mentioned earlier. Lots of them have already been through public consultation. For example, DWDS, waterborne pathogens, boron, bromoxynil, malathion. These are have all been through public consultation already, and some of them are very early in the process, such as THMs, HAAs, and arsenic and stuff like that. So, so these are what we are working on. These are the upcoming priorities, the next ones that we will be working for the next 5 years. These are mainly taken from our priority assessment group 1 from our prioritization process, but also some are microbiological priorities, excuse me. And yeah, so only one, excuse me. So one was added because of the age, which is asbestos. Other than that, these were high priority for health or analytical treatment. These are the list of the public consultations recently completed. At the top, you see malathion and MCPA that were completed in May. Waterborne pathogen, February, and then the list goes on, as you can read. This is the ongoing public consultation. So dimethoate, that is going to start next week for a 2-month up, and then as well atrazine, corrosion control, operational guidance, radiological guidelines, and guidelines for Canadian recreational water quality. There is 3 different chapters that will be soon available for public consultation. All right, the final documents. So you have the list of the ones that we published since our last update from last year, from when we presented to the window on Ottawa last year. So we have metribuzin, one for dioxane, as well as the water talk, aluminum, as well as the water talk, natural organic matter, and the cadmium document, as well as the water talk. We have upcoming publications. So this is the list of the ones that we intend to publish in the next year until next summer. These are the screening values. So in November, last November, we published this list of 4 screening values. And we have this list of upcoming ones. In other web and outreach products. So we have a list of infographics that we are currently developing. So Legionella, that was posted actually in last May 28th, so very recently. We have lead treatment devices, aerator cleaning, recreational water, and asbestos. We also have, as part of the Health Canada Healthy Homes, we're going to have a new water component. And new outreach products in preparation. We have water podcasts, Healthy Schools Day, and this is already, Healthy Schools Day is already presenting materials about indoor air water quality, and we're going to add water quality input into it, as well as water quality videos, which has yet to be determined in terms of the content, but stay tuned. And then we have an update of the summary table available later this summer. Excuse me. So to discuss the Canadian, the Drinking Water Advisory of CNPHI. So CNPHI is a secured web-based platform maintained by the Public Health Agency of Canada, supporting numerous public health alerting and surveillance applications with over 6,000 FPT users. The Drinking Water Advisory is available for use by all drinking water oversight agencies in Canada, providing tools for alerting, reporting, and surveillance. It's helping to characterize the root causes and priority trends related to the occurrence of drinking water advisories in Canada. The tools are also provided to manage information on drinking water systems, as well as drinking water monitoring. So it's helping to inform the sustainability of safe drinking water, emphasizing the importance of equipment and infrastructure renewal and investment. Excuse me. So if we look at the list of the causes of boil water advisory in Canada from 2010 to 2019. So this extract represents 7 out of 14 jurisdictions across Canada. The blue portion of the bar chart shows that the vast majority of the boil water advisories are caused by equipment or process related issues. And then we have E. coli detections that are shown in dark brown, 2% in 2019. And other microparameters, turbidity, total coliform in beige is 11% in 2019. Here you can see the water quality reason for issuing boil water advisories on public systems from 2015 to 2020. So there was 72% of boil water advisories were issued due to line breaks or other pressure losses. Of these boil water advisories, the major causes of pressure loss were water main breaks at 42%, planned maintenance 40%, and power outages 15%. And the boil water advisory issues noting no applicable water quality reason were issued entirely based on operational issues. So these are the operational reasons for issuing boil water advisories on public systems. So the most causes are planned maintenance for 34%, and then treatment or distribution equipment failure or damage. And you can read here for the total percentage. And this is just to prove that most of these boil water advisories are in small systems. So almost 75% affecting systems serving 500 people or less, and 87% on systems serving 1,000 people or less. So it is really the smaller system. So that's it for the updates of the program. How to stay connected. So I would invite any of you to subscribe to our distribution list for getting updates on our publications, as well as our website. So you go on the Canada.ca website, search for drinking water. And then the Canada Gazette is the official newspaper for the Government of Canada. And these are our contacts if you need to ask any question, to our water email address, as well as our toll-free phone number. And that's it.
Thank you very much, Chan, and thank you for getting through that. Why don't you take a big drink of water?
Yeah, I'm sorry. Like, I've had a little bit of a cold lately.
You should come out to Alberta and enjoy the nice humid air out here one day.
Yes. Apologies for the rough voice there.
Well, thank you for getting through it. A great presentation. Thank you very much. What surprises me when I look at your slides is how many parameters you're actively tracking and you have on your plate right now, and you've got going forward. So continuous work going on in the background that maybe a lot of us are not aware of. Do have a couple of questions that came in through the chat. So thank you for sending your questions into the chat. Those of you out there who want to ask a question, and please do so through the chat. Once again, you can ask it in French, and I will do my best to transmit it over to Anne. So let's see. Let's start with the first question. Is there any plan to work on carfentanil or fentanyl or their analogous materials?
No, it hasn't been identified as part of our priorities for the next 5 years. But however, if you have any information to submit, I encourage you to do it to the email address that I posted on my slides.
Okay, thanks, Anne. We have another question in here, a little longer one. DWSVs, which I think is drinking water screening values, for new or lesser known chemicals are often created using evidence-based research done for other more known chemicals like PFAS, PFOA. If prioritization is done every 4 to 5 years, how does Health Canada account for emerging chemicals or chemical substitutes whose toxicological impacts are not yet known or regulated? That's a tough question.
So for new substances that haven't been regulated, we have a department in our branch that are looking into all the new substances. So it's the New Substances Assessment and Control Bureau at Health Canada. And if there is a potential for it to be found in drinking water, and I mean, if it is not regulated yet, then we don't have to worry about it for a drinking water guideline. But if it becomes regulated and might be an issue, we would be in contact with our folks from the New Substances Assessment Control Bureau.
Okay, thank you. Another question here, it just came in, specific one. Is the work done on amaltheion and MCPA available to the public now? And if so, where?
So these documents recently went under public consultation, so they are still available. However, the consultation period is closed, but the documents are still available. If you go on our website and look into current document for available for public consultation, you will have a link that will bring you to for the links for those 2 documents.
Thanks, Anne. And I can validate that because I've done that exercise, gone to look at the whole consultation document that has been finalized and then posted as a technical document, but they are there. You do have to drill down a little bit on the page to find the link, but it is there. Let's see, do we have any more coming in for you? We got a few more questions or time. We got a bit more time for questions. I had a couple that I wanted to ask. How do you deal with monitoring gaps when you're trying to develop or update a guideline? Do you always have enough information, monitoring from utilities across Canada? Does that become a challenge, and how do you deal with that?
Yes, it can become a challenge because it's a little bit the chicken or the egg, right? Until we develop a guideline, we won't have it in the regulation for the provinces, territories to monitor for it. So we rely on our few PTs that have exploratory monitoring programs that go and look for other stuff. Quebec and Ontario do that a lot. Or we can request our PT members to look for it. But often it is a gap that we have to constantly try to fill and get some new data on.
Okay. And another question is, when you're developing, and this is for me too, when you're developing a new guideline or updating a guideline, you go through the consultation process. I know you're reaching out, trying to get feedback. You want to get feedback from water utilities, and I think in particular other organizations. Are you getting enough? Do you think you're getting enough information from water utilities? Could we do a better job of that as an industry for Health Canada?
We do get quite a bit of comments from municipalities. Can there be more comments? Sure, always. We always appreciate the input. It's always helpful to have the perspective of our municipalities, especially during in terms of the impacts of the new recommendation. If we lower a guideline during public consultation, it is the time to tell us if that is something that has high impacts on the municipalities or no. Not at the end of the process, of course. So public consultation is the time for all the municipalities or provincial territorial partners to let us know what their thoughts are on the new proposed recommendation, for sure.
Okay. Yeah, thank you. I got another question here. Earlier, we heard about in the conference, we heard about the Canada Water Agency being developed. Has Health Canada? What is Health Canada? Are you able to talk about what you think about the development of that agency? How this guideline process would work, tie into that at all?
So far, these are still in very early discussions. I don't know, Steph, if you want to jump in on this one.
Sure.
But yeah.
Happy to. So yeah, as Anne said, it's been a consultation phase. This is actually an effort led by Environment Canada, but I think they heard back from a number of stakeholders across the country during those consultations that drinking water was really important to people, and that they wanted to see it included, because the focus of the Canada Water Agency is freshwater resources, which obviously is the source of our drinking water. So I guess to not answer your question very clearly, Steve, but sort of allude to it, we're certainly working really closely with Environment Canada to see how we could integrate. I think some of our early discussions around that seem to be to fill that monitoring gap that you spoke about earlier, because the regulation of drinking water is very much a provincial territorial responsibility. And we provide the science piece in terms of the Canadian Drinking Water Guidelines. And so we're thinking that the Canada Water Agency might provide a good opportunity to enhance the data about what we actually see in Canadian waters and what might need to be addressed through guidelines.
Okay. All right. And I think you mentioned something there too that I think is important, but for all the listeners out there who might not be aware of it, the actual regulation of drinking water systems in Canada is generally a provincial jurisdiction or territorial jurisdiction. There's some exceptions, but federal lands and so on, but and First Nations, but it's largely in the province. So provinces like Alberta can choose to accept the Canadian Drinking Water Guidelines, which they largely do in our case, but in Alberta, or not, right? They can take a different approach or handpick certain guidelines, but it is a provincial jurisdiction who actually sets the permits and approvals for drinking water providers in Canada. So I think I'm glad you sort of pointed that out, Stephanie. And Health Canada provides sort of the reference material, right? And peer-reviewed, scientific, rigorous sort of reference material for the provinces or territories to act on or as they see fit. Let's see, it's 9:29, so I want to thank, we don't have any more, just a comment in the chat that I mentioned from somebody as carfentanil are being seized every day in high quantities, of course, a legal drug. And there are patents, I suppose, or out there. At some point, they will end up in the water cycle. It's just a comment to take back to Health Canada. So I want to thank Anne for getting through the presentation today. Did a great job.
Thank you.
Thanks for answering all the questions. So really appreciate that. And we'll move on now to our next speaker, Stephanie McFayen, who I introduced earlier. Stephanie, are you all set and ready to go?
Yeah, let's see if we can successfully share the screen here.
Stephanie is going to be zeroing in on one particular set of parameters.
There we go. Okay. All right, so I'm going to talk to you a little bit about perfluor. Sorry, I just confirm with you, Steve, that this is it's showing properly as a slideshow for. Yes.
It says perfluoroalkylated substances in drinking water.
Thank you. All right, going forward, I'm just going to say PFAS because that is a mouthful. So the reason that I'm talking a little bit to you about PFAS today is that you may have seen it highlighted in the media. It's certainly become increasingly important for our government and governments around the world as an issue. So I'm going to zero in. I'm going to focus a little bit on PFAS in drinking water, but starting with a little bit of background. So in case you are not aware of what PFAS are. So these are a large group, somewhere around 5,000 at last count, although that number seems to change pretty regularly, of human-made chemicals. They include long-chain PFCAs, they include PFOA, PFAS, Gen X, which is the replacement generation, the chemicals that are intended to replace the PFAS, as well as a whole slew of other chemicals. They've been manufactured and used in a variety of industries around the globe since at least the 1940s, and they're used in a huge range of products. Their qualities make them ideal as stain repellents. They're used in textiles, cosmetics, food packaging, and a big one, firefighting foams. What we have found, research has shown, is that they are both persistent and mobile in the environment, which means once they get there, they last an incredibly long time. Some of the media refers to them as forever chemicals. And they are mobile in that we find them in places in the world where there is no reason to have found them. They have moved with the air, with the wind, with the water. When we've looked, we've detected them in humans, in wildlife, as well as environmental media, and that's everywhere, including the Canadian Arctic. We found it in animals in the Canadian Arctic. We found it in human samples. And they do seem to biomagnify in food webs, which is never a situation that we want to come across. New scientific on, it seems sometimes an hourly basis, continues to emerge on this very complex topic. So what are the implications for human health? Well, lab and studies in animals have shown that exposures to certain PFAS have been associated with a whole slew of health effects: reproductive, developmental, endocrine system, liver, kidney, and some of the most recent information is showing immunological effects. PFOA and PFAS are two of the most studied PFAS in this group of chemicals. And the evidence for them has shown that they can cause tumors in animals when they're administered at high doses. There are some epidemiological studies. So exposure to PFOA and PFAS in particular in human has been also associated with a range of effects, including those listed here: the liver, birth weight issues, metabolism effects, and again, the immune system. So the clinical significance of these findings and the new data that's emerging constantly continues to be examined. So no hard and fast conclusions as of now, but certainly a lot of mounting evidence that there are some potential significant impacts for health. So what's happening in Canada to address PFAS? The government of Canada, so multiple departments, not just Health Canada, evaluated the risks of PFAS, PFOA, and the long-chain PFCAs and published the findings in screening assessment reports back in 2006 and in 2012. The purpose of this was to determine whether they were toxic, either to the environment and to the human health. And those reports at the time determined they were found to be toxic to the environment. And because of that, they were added to the list of toxic substances under Schedule 1 of the Canadian Environmental Protection Act. That allowed the government to then take risk management activities. So since 2016, the manufacture, use, sale, offer, blah, 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 you can't use PFAS, long-chain PFCAs, and products. They've been prohibited with a very limited number of exemptions, such as manufactured items that contain PFOA or long-chain PFCAs under the regulations that you see listed there. I'll also note that last year, 2019, 2020, there was some consultation on further regulations to actually remove that limited number of exemptions. And so sometime before the end of this calendar year, it's expected that those regulations will be updated and the remaining exemptions are going to disappear. So in a nutshell, you can't make these products in Canada anymore. However, as I noted earlier, they are widely distributed already in the environment, and they are still produced in other countries. We also have in sort of the category of risk management activity, both soil quality and other guidelines for other environmental media that are published and available, most of those since 2018, 2019. Most relevant to this particular groups are the guidelines for drinking water quality for PFOA and PFAS, which were published in late 2018. I will talk about those in a little bit more detail, but I think to lead into that, I want to highlight for you that as of April 24th, 2021, the government as a whole has published a notice of intent, and that intention is to look at PFAS as a broad class. So I've put the text there exactly as it appeared in the Canada Gazette, but basically that's the signal intent that from an environmental and a health and a manufacturing, from every perspective you can imagine, the government of Canada is concerned about what the scientific evidence shows about both PFAS and the new chemicals that were used to replace the regulated ones how they're affecting environmental and human health. So that huge class of chemicals, dealing with them on a substance by substance basis is problematic. And so the government wants to look at how to address PFAS as a broad class. In drinking water, where are PFAS coming from? In a nutshell, everywhere. We see them coming out of landfill leachate. There's some evidence from different research papers that you can find them in wastewater discharges, whether that wastewater is direct to the stream or from the wastewater treatment plant or from PFAS producing or using industries. Not a problem in Canada. As I mentioned before, they're not allowed to manufacture them in Canada, but there is no manufacturing. But still in other parts of the world, that's how it's entering the source. In Canada, we've seen issues with the use of firefighting foams. And so we've seen PFAS in water sources when they're located, particularly next to areas where they've used firefighting foams, like say a fire station where there's practice sessions, airports, assorted sites like that. So just a whole variety of places that can discharge PFAS, or they can be carried by air, and then you end up with it in either the surface water or the groundwater source. To circle back to the Canadian Drinking Water Quality Guidelines, I mentioned in 2018, we published guidelines for PFAS and PFOA, and that was followed shortly thereafter by screening values for 9 other individual PFAS. Now, those drinking water screening values are produced when we get a request, whether it be from another government department or from a provincial or territorial partner looking for some guidance because they found that particular chemical in the water and they're looking for a little bit of information. So we've had 9 such requests. We had 9 such requests in early 2019. As part of both the publication and the guidelines and the screening values, we made a commitment, which is kind of a standard one for all of our guidelines, is to continue to review advancements in science. I think it was one of the questions that was asked on Anne's presentation was, what happens, if something comes up between that 4 or 5 year priority cycle? This is the answer. If something becomes a priority based on new evidence, we can add to our work cycle and shift a little bit. I think the buzzword du jour is pivot, but we can adjust what we're working on and shift our priorities if it becomes evident that something needs to be added in a shorter time period. I've mentioned the science of PFAS is complex. I think I've said that a couple times, but there's also currently no consensus about the health effects and the risk assessment approach that is used to derive guidelines for drinking water in particular. I'll give you a little bit of evidence of that as we move forward. There's also a lot of new analytical methods. So, I mentioned up to 5,000 different PFAS. We probably have analytical methods available for around 40, maybe 50 of them in drinking water in different jurisdictions in the world. So that's an evolving piece of science and technology, and the treatment approaches as well. We're trying to understand how effective treatment is against PFAS. This is just simply a listing of our guidelines and screening values for Canadian drinking water quality. So both the PFOA and PFAS guidelines are noted up here. And then you will notice a lot of the screening values are at the same level, that 0.2 micrograms per liter. And those are the ones where they due to a lack of available toxicological information, we've had to use information about other similar PFAS in order to come up with a number that seems reasonably protective. And that's what you're seeing there. So globally, we're seeing some trends in drinking water guideline values for PFAS across the world. Since 2006, so we're going on 15 years here, we've seen a large number of countries and governments and agencies develop guidelines or regulatory values for specific PFAS, individual PFAS in drinking water. The vast majority of jurisdictions have some sort of information for PFOA and PFAS. As I mentioned, they are the most heavily studied. So like Canada, those jurisdictions were able to look at the health information and make some sort of decisions. The key here, though, is that of those huge number of guidelines, no two drinking water guidelines or standard values for jurisdictions across the world. Nobody has come up with the same number. So as I mentioned earlier, there's no consensus about the health effects and the appropriate toxicological approach to deriving these guidelines. So the differences can include the choice of the key health endpoint, the life stage that is believed to be affected, the allocation and uncertainty factors that are being applied, the way in which toxicokinetic differences between rodents and humans are addressed, all kinds of different points in which they diverge across different jurisdictions. The variability in the guidelines that we see spawn almost 2 log differences in concentrations for PFAS and PFOA, as an example. So all of this, though, is really wrapped up in the fact that increasingly agencies, including the Government of Canada, are considering a group or class approach for addressing PFAS. A couple examples of this in the European Commission in December 2020, the European Parliament formally adopted a revised drinking water directive, which set new limits for PFAS in drinking water. It included a sum of 20 specified PFAS and set a limit of 0.1 micrograms per liter. This is considered to be a compromise approach until a monitoring method for all PFAS becomes available. And I've put all in brackets quite deliberately here because, as I mentioned, 5,000 chemicals. Not really sure how we're going to address that issue. Can we develop an analytical method that would really let you get a good idea of everything, all the PFAS that are potentially in the water? So the sum for all of those PFAS is intended to be 0.5 micrograms per liter. So 20 specified PFAS right now, and eventually a sum for all PFAS of 0.5 micrograms per liter. They also have a commitment to publish the technical guidelines on analytical methods, parametric values, and the sampling frequency by January 2024. So even for the 25 specified PFAS that they have right now, some of those aren't measurable yet. They're still working on the technical approach and the problem monitoring and measuring approach. There's also of note that there is a groundwater directive in the European, established by the European Commission, and they've included PFAS in a voluntary watch list in an effort to try to fill that gap about what information's out there. In the US, our neighbors to the south, the unregulated contaminant monitoring rule, which the third one that was published, included the monitoring of 6 PFAAs in approximately 4,900 public drinking water systems. So that monitoring occurred from 2012 to 2015, and those monitoring results are of huge interest both there and here, because it's sort of we often turn to the US and they're much more robust monitoring in many systems to try to inform what we're doing. In that case, those 1 or more PFAAs were detected in 4% of the reporting systems. And groundwater sources in particular had approximately double the detection rates of surface water sources. 1.3% of public water systems reported PFOA and PFAS at concentrations that exceeded the US EPA health advisory, which is set at 0.07 micrograms per liter. What is really interesting is that these detections were geographically widespread, but they did show some associations with suspected sources, industrial sites, military fire training areas, any AFFF certified, so those are firefighting foams are being used there, as well as wastewater treatment. More recently, so November 2016, the US EPA issued health advisories, as noted, for PFOA and PFAS. Those are set at 0.07 micrograms per liter. And in February of this year, the US EPA announced that it would move on the regulatory front to develop drinking water maximum contaminant levels for PFOA and PFAS. And in March of this year, the UCMR5 added 29 additional PFAS to the monitoring regime for public water systems. So we should have a lot more data coming out of the US in the next few years in terms of which PFAS are to be found. So what does all of this mean for guidelines for drinking water in Canada? basically, we are looking at all of these developments, the treatment and analytical method, the push towards class approaches, both globally and from our own government here in Canada, the current Canadian guideline and screening values. Right now, we've got 11 target values out there for people to look at. And then the evolving science about the health impacts of these particular chemicals. And so we're taking a look at what all of that means for the current guidelines for drinking water value and for the current screening values, and trying to make decisions in the most rational and reasonable way. And we certainly want to be as transparent about that as we can. So stay tuned for new information, because we will be looking to this industry and our provincial and territorial partners to help us make these important decisions. And in the same context as Anne has already shared with you. So I think that was, I will leave it at that and open it up to questions.
Thank you, Stephanie, for that presentation. Very important topic right across Canada, as well as across North America and the world. And I think a lot of water utilities are concerned about, what do we do about PFAS if we find it in our drinking water sources. Here's a question that's coming in from the chat. So once again, I encourage everybody out there who has listened in, who would like to ask a question for Stephanie on her talk on PFAS, to enter that question into the chat, and I'll speak it out. We've got some information, 58 attendees right now. Okay, so we should have 58 questions coming in, which we'll have to deal with in just we got some time. Good, almost 15 minutes. Here's one question coming in. A theme has been repeated across sessions, is the importance of taking proactive steps to address issues related to water and wastewater. What proactive steps is Health Canada taking to provide guidance to utilities across Canada in addressing PFAS in drinking water and wastewater treatment processes?
Well, I can't speak to wastewater treatment processes because we don't have any kind of a mandate, unfortunately, on wastewater. In terms of drinking water, in addition to the information that we've published over the last couple of years in terms of the screening values and the guidelines, which do include some treatment information. As I mentioned, we are very active right now in putting a lot of resources to trying to sort through the new information as it comes in, with the intent of providing guidance as quickly as we can. Our role, though, is to make sure that that's robust and defensible and not impose something that isn't based in at least some science or technology background. So that's what we're working on now.
Okay. I'll ask, no new questions yet in the chat, but I'll ask kind of a follow-up from that. Normally, when you do a guideline document, I think there is a piece on treatment processes and how effective they are, and there's a bit of a review. Are you able to comment on how well PFAS compounds in general are removed in drinking water treatment processes? And let's say the conventional surface water process, groundwater often isn't treated other than disinfected. So I think the answer there is they're not removed, but are you able to say anything about treatment processes?
Yeah, so I can speak to the groundwater processes first, in the sense that if PFOA and PFAS in particular are detected in groundwater sources, right now what we're finding is that activated carbon-based technologies are fairly effective at removing even, so definitely you can actually get certified treatment units for PFAS and PFOA that will get you down to that 70 micrograms per liter guideline from their health advisory level from the US EPA, which is a nice low level, so that's reassuring. And in terms of the broader class of PFAS, there's a lot of ongoing research right now, but so far it's very encouraging in that they do seem to remove those PFAS that are found in groundwater to a great extent, so using activated carbon technologies. The question that's remaining that we're all actively looking at is whether they are effective when you've got a really large group or quite a complex mixture of PFAS. What are you seeing at the end, and how often does that mean you have to replace exhausted filter media, that sort of thing? At a conventional water treatment plant, there's less data we are seeing some removals from the data that we've seen, but we're still, that's an active area of review right now for us too, is trying to see how effective that is when you're seeing. Part of the issue has been a lot of studies focusing on just one or two of the PFAS, and we need to try to pull together the information to see, okay, if you've got a large number of PFAS or a whole bunch of, you know, a long list of them, how effective are they? So not a fulsome answer at this time, but very active on it. And we're hoping to have more information publicly available in the not too distant future.
Okay, thanks, Stephanie. So activated carbon, pricey for water, small water utility and a large water utility, that's for sure. Maybe I should start investing in granular activated carbon companies right now. But just another question, looking into the chat here, nothing coming in right now, but I wanted to challenge you a little bit on something here. And you already spoke to it, and I know how different, you know, when you see regulations or guideline values or screening values, they're all different coming across. One thing, you know, that you might get challenged on, well, the US EPA, I think you said, has set a health reference level of 70 part per trillion, I think, 0.070. And our guidelines for PFAS and PFOA are 200 and 600, or 0.2 and 0.6. So they're quite a bit higher, I guess. And maybe if you were challenged with that question, how would you answer it?
Well, so I mean, I think yeah, it's a tough question, Steve, but it's a fair one, right? For so the assessment that we did, and when we published the guidelines, and since then, was really robust, right? So we're very confident in that assessment, but we also acknowledge there's continuous new science coming out, and we are looking at that. And it's one of the reasons that although those guidelines were published just at the end of 2018, and normally you would expect those to sit there getting comfortable for the next decade or so. But in this case, we are already looking at, well, are those still appropriate? Should we be considering all of this new evidence? Well, of course, we're considering all the new evidence, but how should we consider that new evidence, and what impact does it have? And part of that, of course, is the flag of other jurisdictions coming up with a very different number, and how did they get there? And should we have gone that route as well? And so we definitely take that into account, and that's what we're in the process of doing right now. And so certainly for the health effects on which we based PFAS and PFOA, those are still lifetime protective for those particular health effects. What we need to do now is look at the data on what other health effects are people using, and how did they come up with those different values, in order to ensure that either we're still satisfied or make revisions as needed.
Okay. Appreciate that answer. Oh, we got another question just came into the chat. Well, I suppose we should ask this one. In our discussion towards the development of the Canada Water Agency, that came up again, we've been hailing the Canadian Drinking Water Committee, and I think that's Federal Provincial Committee, and the Drinking Water Guidelines is a great example of federal leadership, knowledge sharing, provincial collaboration. Does Health Canada see changes to how they would do things with the Canada Water Agency? Any new benefits?
So I to the best of my knowledge, that's not on the table, right? For we have a mechanism that works really, really well. And so what we're looking to for the Canada Water Agency is to fill any gaps that we see in the process. But the collaborative nature of the Committee on Drinking Water is something that we're really, really proud of. And I think it's one of the reasons that we do have really excellent drinking water quality in this Canada, as you know, in general, is that when we work together, I think you mentioned, Steve, and I both mentioned earlier that it is a PT responsibility to develop the regulations with some exceptions on federal lands. But the fact that we develop the drinking water guidelines in a collaborative way and take into account treatment and analytical issues is why we get very good uptake across the province and across the country. And so I don't think we would want to adjust something that doesn't need adjusting in that sense. So are there things that we can improve? Absolutely. And if the Canada Water Agency is the way to do that, then hopefully we'll identify some mechanisms. So, and as I mentioned earlier, I think the biggest one for us in terms of what a Canada Water Agency might be able to do is improve that exposure assessment and our understanding of what Canadians are actually exposed to in drinking water.
Okay. Let's pivot from a policy question to a more technical question. You use that word pivot in your talk, and so that inspired me. Word of the buzzword of the day. Okay, this is a tricky one, but I'll throw it at you. See what you because it's sort of a treatment question, but it's a really good one because when engineers think about treatment, oh, yeah, let's put carbon in, it'll solve everything. But what happens to PFAS, PFOS, etc., that is absorbed onto activated carbon? How are these contaminants finally removed from the environment?
An excellent question, and it's very much top of mind. And although we often don't in our drinking water guidelines talk about the disposal, we're certainly of these materials. We are certainly, that's on the radar, right? You're absolutely right. Now we've got these long-lasting persistent chemicals in the filter media, and what do we do with them? So our partners, we collaborate really closely with the US EPA, and they're actively trying to look at some of the research that will maybe help answer that question, help us figure out. And I think in this particular guideline, and for the guidelines for PFAS as we move forward, well, we don't get terribly prescriptive about what to do with these things. I think this one will probably deserve the nod that says you have to consider the fact that you now have some media that has to be disposed of, work closely with your provincial territorial regulators to ensure that you're disposing of it properly.
Yeah. And that question, maybe I'll add a little bit to that answer because it could potentially become hazardous waste material now after it's and I think we've seen the problems with arsenic removal, for example. The media is full of arsenic now, so you got to be careful how you deal with it. It won't be carbon, it's something else. But generally, what happens with carbon is it would a water treatment operator would have a company remove the exhausted media and deal with it, and often regenerating it because it's got a lot of value into it, and usually through some kind of thermal process. But I can't tell you whether the PFAS or PFOS break down in that thermal process or end up in yet another stream. That has to be eventually dealt with through incineration or some other method. That's a great question. What happens even if we can remove it all from the drinking water? Where does it finally end up? We just got a few minutes left. We've exhausted the questions on the chat. Oh wait, no, we got one come in. When a new guideline, this will be our last one. When a new guideline is set, how long does the treatment plants have to comply with the new guidelines? Were there any cases that you have observed in the past that treatment plant produced new treatment process that could not comply with the guidelines?
So that's a question that is kind of tough to answer because it is actually up to the province or territory to set the first of all whether they choose to adopt a guideline, which if they feel it's not relevant to their jurisdiction, then they won't necessarily do that. But then it's up to them to set the timelines. They have the flexibility. They can say for lead, for example, the lead guideline came into effect and everybody moved very, very quickly to try to say how fast they could at least come up with a plan for addressing. Whereas many others, they'll take several years to work it into the regulation, and they'll give treatment plants several years more to adjust because everybody recognizes that these are not decisions that are made on the fly when it comes to very expensive and long-term infrastructure like drinking water treatment infrastructure. So no easy answer. It's different for every jurisdiction, and it is a PT decision about how long you get. And I'm not sure. I imagine that some of our partners in the provinces and territories have examples of where a treatment technology was put in place and it didn't work as intended. I'm sure that happens, but I don't have one to give you.
Yeah, thanks for that. And as a regulated sort of entity that I work for, the regulators, they're the ones, the provincial regulators are the ones who take the Health Canada guidelines and put them into regulation and set the requirements for water utilities. And just as Stephanie said, it really it's down to the provincial or territorial regulator to determine that. And generally, they do give they're sensitive to the practical limitations of drinking water systems, and they will provide a time frame for water utilities to adapt to any new Canadian drinking water guidelines. It'll be different from jurisdiction to jurisdiction. There was one last question here, but that I'll just throw out there. Somebody, I don't know if you're going to be able to answer this before we quit. Has been any group thinking of using gamma radiation to destroy the molecular structure of PFAS? And I'm certainly not aware of any that are doing that. Not aware of it. No. So maybe that's a great idea that you can pursue. So I want to end the session by thanking our two speakers and Vezina, Stephanie McFayen with Health Canada today. Full session, lots of great questions. And I would encourage everybody, we have a break now, I think at the end of this section, but it's starting at 1 p.m. Eastern time. There's the Where Technology Meets Stormwater session. So I'd encourage you to attend that, all the delegates out there. Thank you very much and have a great day.